The surgery chapter is the largest and most complicated chapter in CPT. The surgery chapter is organized by body system and types of procedures. Specialists may find that they code mainly from one subsection of the surgery chapter, whereas general surgeons code from various subsections within the chapter. The surgery chapter of CPT manual begins with general information and surgical guidelines. Prior to selecting codes, coders need to review the definitions and concepts included in the surgery guidelines found in the CPT manual prior to the surgery codes. These guidelines address the physician services, packages, follow-up care for diagnostic procedures, follow-up care for therapeutic procedures, materials supplied, reporting more than one procedure or service, a separate procedure, unlisted service or procedure, special report, and surgical destruction. Becoming familiar with the organization of the surgery chapter will make code assignment much easier. An understanding of the arrangement will help the coder to understand that the chapter subsections are arranged by body system, such as Integumentary system 10040 through 19499, cardiovascular system 33010 through 37799. After the body system, the subsections are further divided by anatomical site, beginning with the top of the body, that's the head or the scalp, and working down to the feet and the toes, and then from the trunk of the body outward. A procedure code is finally selected. Understanding the organization of the surgery section is valuable when a coder is attempting to determine if they are reviewing the correct section of CPT manual for a code selection. Understanding whether the procedure performed is a diagnostic or therapeutic procedure can also be helpful when determining a code assignment. Diagnostic procedures are completed to determine a diagnosis and establish a care plan. Therapeutic procedures are part of the care plan and are used as treatment for diagnoses, which has already been rendered. Prior to the code listings in CPT manual, the surgery section specific guidelines are presented in the manual. Prior to the code assignment, it is important to understand what is included in a surgical package, also known as a global package. When a code is selected, it represents specific services that are included in the CPT surgical code. This term is defined differently by various payers, but the CPT book defines the surgical package as follows. Local infiltration, subsequent to the decision for surgery, one related evaluation of management encounter on the date immediately prior to or on the date of the procedure, immediate postoperative care, writing the orders, evaluating the patient, in the postoperative recovery area, and typical postoperative care. Many payers establish specific time periods for the postoperative period. This is referred to as the global days or global period. For example, Medicare defines surgeries as major or minor surgeries. Major surgeries have 90 postoperative days, whereas minor surgeries have 0 to 10 days postoperative. Payers should be consulted regarding their individual policies regarding surgical packages. Medicare surgical package protocol is explained on the CMS website. Services that are included in Medicare's global surgical package include the postoperative, preoperative visits, intraoperative services, complications following surgery, postoperative visits, post-surgical pain management, and supplies, and miscellaneous services. If the provider supplies additional materials over what is typically used for a procedure, the provider can bill drugs, trays, supplies, and other materials. However, caution should be used when billing these codes because the documentation has to provide evidence to the necessity for these additional materials. Following some code descriptions are the words separate procedure. These codes report procedures that are typically part of a larger service or procedure and therefore are not reported if the larger procedure is performed. However, if the code description designed has a separate procedure is completed alone, then the code is reported. NCCI, National Correct Coding Initiative. This initiative was implemented to standardize proper coding and payments for Medicare Part B claims. The purpose of the NCCI has evolved to include outpatient hospital services and fiscal intermediaries. The payment denials are generated when a pair of codes is submitted together on the claim and the processing system rejects the claim based on coding conventions. Medicare does not allow beneficiaries to be billed if a denial occurs based on an NCCI edit, which could put your practice at financial risk. The coder could study these denials in detail and avoid repeating the same mistake. Education to avoid further denials is usually enough to stop the denials from occurring with any frequency. The NCCI is set up in a table format. Column 1 and Column 2 of the correct coding edits is the first table. This used to be known as the comprehensive or component edits. The second table is known as mutually exclusive edits. The coder is listed in Column 2 of the mutually exclusive edits table and are not payable services when billed with the coder in Column 1. As an example, if we wanted to bill code 10021 and code 36410 together, our claim would cancel our edit out due to NCCI coding guidelines. CPT code 10021 encompasses the services rendered in 36410, and therefore 36410 cannot be billed separately when reported with code 10021. Mutually exclusive codes are codes that cannot physically be performed together during one encounter on the same anatomical site, or code pairs that, by definition, would not be performed at the same encounter. The mutually exclusive code pairs, in certain instances, can be billed together if a modifier indicator is noted. Remember the following. The standard of care is to accomplish the overall procedure. And 2, to successfully complete a procedure, another procedure may also need to be performed, but these procedures may not be separately billable depending on NCCI. Correct coding a service means that the coder needs to be reporting the service rendered with the most comprehensive code available. Accuracy and knowledge of the procedure are important elements in coding a service correctly. Coding correctly also means the coder has an understanding of the terms unbundling and fragmenting. Unbundling occurs when procedures are performed and services are separately coded and submitted to the insurance company for payment. Fragmenting is a term used when several procedures are performed during one surgical encounter, and instead of one code to capture all services rendered, each service is broken out or fragmented and assigned to its own code. Coders also refer to assignment of a lower E&M service as downcoding when a higher level of service is supported. When reviewing a medical record documentation to see whether it supports the level of service billed, a coder might note that the doctor has not documented services to the level he or she is trying to bill. The coder is then forced to downcode the service to a change or charge that is in line with the documentation. Repeated denials for unbundling practices can be a red flag to Medicare and other insurance carriers. This red flag may trigger an audit of the medical practice coding habits to determine whether the unbundling that is occurring is intentional or not. If it is determined that your practice is intentionally unbundling services to receive additional payment, legal action may be taken against the practice.